Yep. So I'm carrying on with this conversation with Dr. Vivian Shaw about classical anatomy, and I'm just fascinated by this idea of being able to feel the anatomy. And I guess I'm in practice. I'll be, I'm feeling channels every day. What sort of insights is this going to add by doing this deep dive into anatomy?
So all of the evidence that I've found points to acupuncture points are places that are of anatomical significance in
Mm,
some way. Um, so one of the examples that I really like is one of the most common acupuncture point prescriptions is the four gates. So liver three and large intestine four. And when you look at those 2 points, it's like they are where the arteries they kind of come down and then they roll around and they go under. So in the hand and in the foot, you've got this point where the artery sort of effectively makes a loop. And so by putting your needles in, you're putting your needles in at the ends of the loop on the hand and on the foot. And by doing that, you're effectively going to be able to regulate the entirety of the blood system um, because you've balanced in both of those most distal areas.
mm. Wow, that's amazing. Excellent.